5 medical screenings. After 60, when the risks may outweigh the benefits. After the age of 60 or 70, the main goal of medicine is no longer the same as when we were younger. In our 40s and 50s, early detection of disease can truly add many years to life. But in our 70s and 80s, what matters more is staying physically strong, mentally sharp, mobile, and independent for as long as possible. In other words, the goal is no longer to find every abnormality in the body, but to protect quality of life. Many medical screenings that were very beneficial in middle age start to offer less benefit as we get older, while the risks from tests and treatments begin to increase. And one of the biggest dangers in modern medicine is not always the disease itself, but something called the medical cascade effect. It often starts very simply. A routine test finds a small abnormality. Then comes more testing, then a biopsy, then medications, then side effects, dizziness, a fall, a hospital stay. And within a few months, a person who was once completely independent and active can become someone who depends on others for daily life. In reality, many older adults do not become weak because of the original disease, but because of the chain of medical interventions that started after finding a problem that might never have harmed them in the first place. So today, we're going to talk about 5 medical screenings that people over 60 or 70 should think carefully about before deciding to go through with them. 1. Is colonoscopy after age 75? Colonoscopy is one of the most common and valuable cancer screening tests for people in their 50s and 60s. At that age, detecting and removing polyps early can prevent colon cancer and truly help extend life expectancy. This has been proven by many medical studies. That is why, for many years, colonoscopy has been considered almost a routine screening once people reach middle age. However, after the age of 75, the situation begins to change, but very few people are clearly told about this. Colon cancer is typically one of the slowest growing cancers. On average, it takes about 10 to 15 years for a small polyp to develop into a dangerous cancer. This means that if a person who is 76 or 78 has a colonoscopy today, and a small polyp is found, the chance that this polyp will actually cause serious harm during the rest of their lifetime is relatively low, especially if the person already has an average life expectancy or other chronic health conditions. But while the benefits decrease with age, the risks of the colonoscopy procedure increase. First, there is the preparation before the procedure. Patients must drink strong laxatives to clean out the colon. For younger people, this is mostly uncomfortable. But for someone in their 70s or 80s, this process can cause serious dehydration, low blood pressure, and electrolyte imbalance. This is not a minor issue and can sometimes lead to hospitalization. Next is sedation or anesthesia during the procedure. Older adults metabolize sedatives more slowly than younger people, and after the procedure, some may experience confusion, temporary memory problems, or in some cases, longer-lasting cognitive decline. There is also a rare but very serious risk: bowel perforation during the procedure. In a younger patient, this is already dangerous, but in an 80-year-old, it can become life-threatening and may require emergency surgery. So the most important question is not simply whether you should have a colonoscopy, but why you are doing it and what will happen if something is found. This is a very important question that older adults should ask their doctor before agreeing to a colonoscopy. If the colonoscopy finds a polyp or early-stage cancer, would we actually treat it with surgery or chemotherapy? And if we would not pursue aggressive treatment, then why are we doing the colonoscopy? In many cases, the answer may be monitoring rather than aggressive treatment. And if the final plan is just observation, then sometimes the risk of the colonoscopy may outweigh the benefits. So after age 75, colonoscopy should no longer be done automatically out of routine, but should be considered based on overall health, life expectancy, and the patient's personal preferences. More testing is not always better, especially as we get older. At this stage of life, the goal is not just to live longer, but to live healthier and remain independent for as long as possible. 2. PSA testing and mammography. After age 70, when it comes to cancer screening, most people believe that the earlier cancer is detected, the better. And in many cases, that is true, especially for younger and middle-aged adults. But for people over 70, the situation becomes much more complicated. and particularly for prostate cancer in men and breast cancer in women. The reason is that in older adults, many cancers grow very slowly. Some tumors may take 10, 15, or even more years before they cause serious symptoms. This leads to a fact that is not often discussed. There are cancers that a person can live with for the rest of their life without ever being affected by them, and they may eventually pass away from something completely different, such as heart disease, stroke, or simply old age. The problem is that once a PSA test or a mammogram detects cancer, it becomes very difficult to do nothing. Both doctors and patients often feel that something must be done immediately. And from that point, a chain of treatments usually begins. Typically, after a screening test suggests possible cancer, the next step is a biopsy. A biopsy can cause pain, bleeding, infection, and a great deal of anxiety while waiting for the results. If cancer is confirmed, patients are often advised to undergo surgery, radiation therapy, or hormone therapy. These treatments can save lives in many cases, but in older adults they can also cause significant side effects. For example, prostate surgery can lead to urinary incontinence, meaning the patient may need to wear pads or diapers long-term. Many men also experience sexual dysfunction, long-term fatigue, and reduced quality of life. Hormone therapy can lead to bone loss, muscle weakness, and an increased risk of falls. For older women, breast cancer surgery and radiation can result in a recovery period that lasts months or even years, often accompanied by pain and limited mobility. The important thing to understand is that detecting cancer does not always mean living longer. In some cases, detecting cancer early in older adults may simply lead to years of treatment, side effects, anxiety, and reduced comfort, while the tumor itself might never have caused serious problems during the rest of their life. So before having a PSA test or a mammogram after age 70, an important question to ask your doctor is, if this test finds cancer, how aggressively would we treat it? Surgery, radiation, or just monitoring? And how would that treatment affect my quality of life? For older adults, sometimes the best option is not immediate treatment, but careful monitoring, symptom control, and focusing on quality of life. Because at this stage of life, living comfortably, independently, and with as little pain as possible is often more important than pursuing every possible treatment. 3. Cardiac stress testing. Without symptoms. Cardiac stress testing is a very common test, especially in older adults. During this test, you walk or run on a treadmill while doctors monitor your heart rhythm, heart rate, and blood pressure to see whether your heart is getting enough blood during physical activity. If you have symptoms like chest pain, shortness of breath, or dizziness when walking, this test can be very helpful. However, the problem is that many people over the age of 70 are sent for stress testing even when they have no symptoms at all. Sure, if you are over 70 and you do not have chest pain, you do not feel short of breath when walking, you do not feel dizzy during activity, you are able to function normally in daily life, then a cardiac stress test may sometimes cause more problems than benefits. The reason is that in older adults, this test has a relatively high false positive rate. That means the test result may suggest there is a problem, even though the heart is not actually in serious danger. But once a test result comes back abnormal, it becomes very difficult to stop there. Doctors will usually recommend more advanced testing, and from that point, a chain of interventions often begins. Coronary angiography, stent placement, or bypass surgery. These are major procedures that carry real risks such as bleeding, stroke, kidney injury from contrast dye, surgical complications, and long recovery time, especially in older patients. What is important to understand is that many large studies around the world have shown something very important. In patients with stable coronary artery disease and no symptoms, placing stents or performing bypass surgery does not help them live longer compared to treatment with medication and lifestyle changes alone. In other words, many people go through major heart procedures, but their life expectancy does not increase compared to simply taking the right medications and living a healthy lifestyle. So what actually helps you live longer and avoid heart attacks? Not more tests and not more surgery, but very basic things. Good blood pressure control, cholesterol control, not smoking, staying physically active, maintaining a healthy weight, controlling blood sugar if you have diabetes. These may sound simple, But decades of research have shown that these factors reduce the risk of heart attack, stroke, and death far more effectively than relying only on surgical procedures. So if you are over 70 and your doctor recommends a cardiac stress test, even though you have no symptoms, ask one very important question. If the test result is abnormal, what will we do next? And will those procedures actually help me live longer, or will they just lead to more procedures? Sometimes the best decision is not to do another test, but to focus on controlling blood pressure, cholesterol, staying active, and keeping your body strong every day. Because when it comes to heart health, long-term lifestyle habits are often far more important than a single test done in a hospital. 4. Bone density testing, DEXA. After age 80, bone density testing using a DEXA scan is a very common test in older adults to check for osteoporosis and assess fracture risk. The scan itself is very simple, painless, uses a very low dose of X-rays, and is generally considered safe. Because of this, many people assume the test is completely harmless and that doing it more often is always better. But the real issue is not the scan itself. The issue is what happens after the results come back. When a DEXA scan shows osteoporosis, the almost automatic response in many cases is for the doctor to prescribe osteoporosis medications, usually a group of drugs called bisphosphonates. These medications work by slowing down bone loss, and in the right patient at the right age, they can reduce the risk of fractures. However, in very elderly patients, especially after age 80, the situation becomes more complicated. Bisphosphonate medications can cause several side effects, such as esophageal irritation, stomach pain, difficulty swallowing, and inflammation of the esophagus if not taken properly. Older adults often already have sensitive digestive systems, so these side effects can lead to poor appetite, weight loss, and overall weakness. In addition, with long-term use, there is a rare but concerning complication called an atypical femur fracture. Ironically, these medications are meant to prevent fractures, but by suppressing the natural bone remodeling process for too long, old bones can become brittle in a different way and lead to fractures of the thigh bone even after a minor fall, or sometimes without a fall at all. But the most important thing many people do not realize is this. In very old adults, fractures often do not happen, simply because bones are weak, but because of falls. And if a fall does not happen, the risk of fracture drops significantly, even if bone density is low. So what actually prevents fractures in people over 80 is not just medication, it is fall prevention. And to prevent falls, the following things are often more important than a bone density number on a test result. Building muscle strength, especially leg strength. Practicing balance exercises to prevent losing balance when turning or stepping up and down. Installing grab bars in the bathroom and along stairs. Making sure the home has adequate lighting, especially at night. Using non-slip mats in the bathroom. Reviewing medications, since many drugs can cause dizziness or low blood pressure. Taking vitamin D if deficient, eating enough protein to maintain muscle strength. Many studies have shown that exercise programs focusing on muscle strength and balance can reduce the risk of falls and fractures more effectively than medication alone in many older adults. You can remember one very simple but very important idea. Prevent falls equals prevent fractures. So if your doctor recommends a bone density test when you're over 80, the most important thing is not just the bone density number, but the conversation that follows. You should ask your doctor, should we focus on medication or should we focus on helping me avoid falls? What exercises should I do, and what changes should I make at home and in my daily life to reduce my risk of falling? At this age, the goal is not just to make the bone density number look better on paper, but to help you walk steadily, avoid falls, avoid fractures, and remain independent. And sometimes, a grab bar in the bathroom, a pair of non-slip shoes, and a few sit-to-stand exercises each day can be far more important than a prescription. 5. Carotid artery ultrasound without symptoms. A carotid artery ultrasound is a test used to examine the blood vessels in the neck that supply blood to the brain. The purpose of this test is to see whether the arteries are narrowed by plaque buildup, which could increase the risk of stroke. On the surface, this sounds very logical. Detect narrowing early, intervene early, and prevent a stroke. That is why many older adults are sent for carotid ultrasound as part of routine health screening, even when they have no symptoms at all. However, the issue is that for people who have no symptoms, meaning they have never had a stroke, no weakness on one side of the body, no speech difficulty, and no temporary vision loss, routine carotid screening often does not provide as much benefit as people think. Imagine a very common situation. A 72 or 75-year-old goes for a general health checkup. The doctor orders a carotid ultrasound and finds a 60% or 70% narrowing in one artery. Immediately, everyone becomes worried. The patient is then referred to a vascular surgeon and may be advised to have surgery or a stent placed to prevent a stroke. This sounds reasonable, but here is something very important that many people are not clearly told. For people without symptoms, the risk of stroke during surgery or stent placement may be equal to, or even higher than, the risk of stroke if nothing is done. In other words, the surgery performed to prevent a stroke can sometimes cause the very stroke it is trying to prevent. Many large studies have compared two groups of patients. One group underwent carotid surgery or stenting, while the other group received medical treatment such as cholesterol-lowering medication, antiplatelet drugs, and blood pressure control. The results showed that in many patients without symptoms, the difference in stroke risk between the two groups was very small, while the surgery group had additional risks from the procedure itself. Because of this, the American Heart Association does not recommend routine carotid artery screening for people who have no symptoms. However, in reality, this test is still performed very frequently, often as part of routine checkups or simply for reassurance. It is important to understand that finding a narrowed artery does not automatically mean you need surgery. In many cases, the best treatment is medical management and lifestyle changes. The things that truly help reduce the risk of stroke include good blood pressure control, cholesterol control, not smoking, diabetes management, staying physically active, eating a healthy diet, taking medications as prescribed by your doctor. These factors have been proven to significantly reduce stroke risk, and most importantly, they do not carry the risks associated with surgery. So if one day your doctor recommends a carotid ultrasound even though you have no symptoms, ask a very important question. If the ultrasound shows a narrowing, what will we do next? What is the risk of surgery? And what is the risk if I choose medication and monitoring instead? You need to know both numbers before making a decision. Sometimes the best approach is not to find and fix every narrowing in the body, but to control the major risk factors and live a healthy lifestyle. Because after age 70, the goal is not to have perfect test results, but to avoid stroke, avoid disability, and remain independent for as long as possible. What should you focus on? After age 70. After the age of 70, the most important goal in healthcare is no longer trying to detect every possible disease in the body, but rather focusing on the things that truly help you stay healthy, independent, and maintain a good quality of life. Simply put, the goal is no longer to have a perfect body on lab results, but to have a body that is strong enough for you to walk on your own, take care of yourself, stay mentally sharp, and not depend on others. There are several things that older adults should truly focus on. First is blood pressure control, because high blood pressure is one of the leading causes of stroke, heart failure, and kidney failure. Next is controlling cholesterol and diabetes, as these are major risk factors for heart disease and stroke. In addition, regular vision and hearing checks are very important, but often overlooked. Poor vision increases the risk of falls, while hearing loss has been linked to faster memory decline and dementia in older adults. Vaccinations such as flu, pneumonia, and shingles vaccines are also simple but very effective ways to prevent illnesses that could lead to hospitalization and rapid physical decline in older adults. Another very important thing is reviewing all medications once a year. Many older adults take multiple medications, and the combination of these drugs can cause dizziness, falls, confusion, and fatigue. And finally, perhaps the most important of all, exercise to maintain muscle strength and balance training to prevent falls. Strong muscles and good balance can help prevent fractures, avoid hospitalization, and allow you to live independently longer. So the goal of medicine after age 70 is not simply to help you live as long as possible at all costs, but to help you remain independent, mentally sharp, and maintain a good quality of life for as long as possible. 3 important questions to ask your doctor. Before any test, before agreeing to any medical test, especially after age 60 or 70, there is something very important that many people forget. You have the right to understand why the test is being done and what will happen afterward. Many people simply undergo tests because the doctor orders them, but they do not know what will happen if the result is abnormal, and sometimes that leads to a chain of tests, treatments, and complications that they were never prepared for. So there are a few very important questions you should ask your doctor before agreeing to any test. The first question is, what is this test looking for? You need to understand the real purpose of the test and what condition it is trying to detect. The second question, and perhaps the most important one, is, if the test finds something, what will we do next? Will there be surgery, strong medications, long-term treatment? Because sometimes, if a condition is found but no major treatment would be done anyway, then the test may not be truly necessary. And the third question is, what are the risks of this test or treatment for someone my age and health condition? The risks for a 50-year-old and an 80-year-old can be very different, but this is not always clearly explained. And one more very important question that many people never ask: what happens if we do nothing and just monitor the situation? In medicine, monitoring is sometimes a completely reasonable option, and it does not always mean doing nothing. These are very simple questions, but they are very important, because when you ask these questions, you are not being a difficult patient. You are becoming an active participant in your own healthcare. Everything we share in this video is not meant to tell you to refuse medical tests or treatments, but to help you understand that every test and treatment has both benefits and risks, especially for people over 60 or 70. The goal is not to do as many tests as possible, but to do the tests that are truly appropriate for your age, overall health, and life goals. Many geriatric doctors say that after age 70, the most important goal is not simply to extend life, but to maintain mobility, mental clarity, and independence. The best medical decisions are usually made through careful discussions between you and your doctor, based on your overall health, medical conditions, life expectancy, and personal preferences. If there is one important message from today's video, it is this: before any test, ask what will happen next if the result is abnormal, and whether that test will actually change your treatment plan. This video is for general health education only and does not replace personal medical advice. If you have health concerns, please consult your doctor for advice specific to your situation. Thank you for watching Health Revival. If you found this video helpful, consider sharing it with your family and friends so more people can make informed and safer healthcare decisions.